Okay, so welcome everybody. My name is Dawn Hutchins. I'm the owner of a company called Veggie Cooking, and our motto is "Learn to cook, love your veggies." And I am basically a whole food plant-based chef, and I have my friend Heather with me hosting as well.
Hey guys, I am Heather Borders and I am a registered dietitian and owner of Kylo Nutrition here in Jacksonville, Florida.
Very cool. So we have Liz Winings here with us, and she is a nurse that specializes in mental health. So welcome, Liz. And would you please tell us a little bit about your background and what you do?
Yes, absolutely. So I am a psychiatric nurse practitioner and my board certification is across the lifespan. I also have my doctorate in nursing and I subspecialized in lifestyle medicine and plant-based nutrition. So I kind of created a position that didn't exist at the time, which is really exciting that now you can train in lifestyle medicine and sit for the boards and all those things. So I practice primarily in the outpatient setting, working with children and adolescents in mental health. And then I also am an assistant professor in nursing at Jacksonville University. So I have the opportunity to teach in the psychiatric mental health realm, but also weaving in lifestyle medicine to the education.
That is so amazing. Yes, welcome everybody. We're so glad you're here. And welcome, Liz. We're so glad that you're here as well. So the first thing we usually like to do is talk about the recipe that our doctor or clinician provided. And so Liz actually submitted her very own recipe called I'll Have Seconds Soup. And I made that today for lunch. It was absolutely delicious. And I'm going to show you here what I have. So we are sending out the recipe. If you just joined us a little bit late, we'll send out this recipe, but you guys have got to try this. I served it with potatoes at lunch and it was absolutely delicious. It is a whole food plant-based, oil-free, and it has coconut milk in it, which makes it really rich and delicious. So the only thing I changed was I had some spinach and I threw that in, and then I had some that in as well. So Liz, tell us why this was the recipe you chose and what you love about this recipe.
So I'm a big fan of recipes that are easy to assemble. And so I feel like this is something that is a nice base that you only need a couple of ingredients to make that you probably have on hand, like lemon juice. If you're plant-based, if you're not, you might have to get something like nutritional yeast, but it's really simple. And I have found that once in a while adding coconut milk to dishes makes them really creamy. And there's that nice mouthfeel where it's just something that you don't always have in plant-based eating. So I was just playing around and it turned out really good. And I thought this would be fun to share. My husband loves mushrooms, so it was an effort to use a lot of the mushrooms we had in our fridge and make something a little bit different.
Very cool. It was awesome. You want to, I just muted everybody just because we were getting a little feedback there. But Heather, do you want to take the next section?
Yeah, I was just going to say, I know we talked about this, Dawn and I beforehand, but this recipe, we always talk about ways to change it up in terms of, you can change the flavor of something and make it an almost completely different dish, even using the same ingredients. And so I could see how you could totally make this like a curry dish. And I think you mentioned that you added some spinach, Dawn. You could easily add any other green to this. You could add it over rice or quinoa. It's really easy to make this dish just by a few changes, making it almost completely different. So we like versatility and I like options. And if I were to give it a second title, I would call it the kitchen sink soup.
Yes.
I love that.
Yeah. All right. So Dr. Winings, tell us about your journey. What led you to being a nutrition focused nurse practitioner? And, specifically what led you to plant-based nutrition? How did you get here?
Well, it was a winding road. It started at the bedside as a registered nurse. So I worked at the Veterans Affairs Hospital in Gainesville, Florida, and I saw veterans having amputations as a complication of poorly controlled diabetes. And as a nurse, I was really confused that this was the solution to a health problem. And I had a few veterans with subsequent amputations, so like a toe and then a foot, and then another portion of their leg. And so that is a really startling thing to see. And then there's the question of, when do you stop cutting? Like, that was a very hard thing for me to wrap my mind around, that someone could have multiple surgeries removing parts of their bodies and continue to have the same problem. So that just sent me down a path of problem solving. What can we do differently in healthcare? And I'm just going to put this in so that you don't have so much background noise. Can you still hear me?
Yes, we can hear you.
So that was my entry point, a question: how could we manage a lifestyle disease with lifestyle? Because my understanding was that most of the diabetics I was interacting with were not insulin dependent. They were type 2 that could be modified by their lifestyle. So I had a registered dietitian on my floor who gave me the Omnivores Dilemma, and then I watched Forks Over Knives, and that sent me down a path of learning more about nutrition. I knew that I wanted to go on in nursing. I thought that I wanted to be an acute care nurse practitioner. And when I realized the healthcare model is not set up for time in the acute care setting to actually educate and walk alongside people through behavior change, I decided I would go into mental health, simply because that was where you had more time with your patients. And I thought it would be a good way to learn more about behavior change. And it has been. So that's kind of how I started to marry the two together.
And children, right, as well?
I'm sorry, I didn't hear the question.
You do a lot with children?
That's correct. So I subspecialized in pediatric psychiatry. And so again, when you start to go down this path of prevention, where do you actually have the opportunity for the highest impact? In my experience, it's been with children and families. So most parents are really passionate about their child's health and wellness and their nutrition. And it's a very easy entry point to talk about your family's behaviors. And one of the best entry points that I find is starting to increase fruits and veggies, increase water, instead of getting hung up on this idea of what can I eat, what can't I eat. If we just shift that focus towards, hey, why don't you just start throwing greens on their plates once a week? Why don't you start putting things in a smoothie? It's a really fun and creative way to figure out how to increase whole food, plant-based nutrition in the pediatric population. And there's so many other benefits that come along with that are in my subspecialty. So when I'm working with children with ADHD or anxiety or depression, there's more and more research coming to light on the precursors to our body's ability to build our neurotransmitters. It comes from whole foods. So it's not surprising to us who've been in the literature, but I think to the general population or to parents, saying that, yes, it makes a difference what you put on your child's plate to their body's ability to regulate their emotions. Like connecting that dot, it's really powerful. So I love empowering parents to nurture and take good care of their children with their nutrition, but then also circling back, because they're in my office for mental health. So making sure that I'm honoring that primary visit, if that makes sense. They're coming to me for a reason. I don't want them to feel like I'm taking them on a tangent.
That makes total sense.
Mm-hmm.
Well, let's talk more about the connection between nutrition and mental health. Could you expand on that a little bit, of just how what we eat really does affect our mental health and as well as our kids?
Mm-hmm. Absolutely. So it's really helpful to conceptualize your body is not divided. So there was a long time in science where we didn't have the same depth of knowledge or data about the brain and what was happening on a neuronal level. And so it was hard to have the same evidence-based conversation related to mental health that we could related to physical health. For example, you can draw someone's blood and see that they have elevated cholesterol or that they have elevated blood glucose, but we haven't been able to do something like that in mental health. And so the buy-in there on saying there is actually a chemical underlying cause for these symptoms has been a little bit more of an uphill climb. What's so exciting is with imaging, so with functional MRIs and studies, we actually have more and more data that shows the areas of our brain that are impacted when we make certain lifestyle changes. And so that's one area that we're seeing this huge connection. The other is with the gut microbiome. So 10 years ago, if you were to say the gut-brain connection, you might get a funny look. People did not understand what was meant by that. Now, I think that's becoming really common language where individuals in the healthcare setting will talk about, yeah, there's importance to pay attention to your gut microbiome. So to the psychiatric world, it's a light bulb because we've experienced for a long time individuals who are taking medications for their mental health have substantial GI side effects. Well, it's not surprising because the serotonin that we're targeting in the brain is also throughout the gut. So those serotonin receptors. So there's all of these different ways where we're seeing that connection between the mind and the body on a physical level. So what does that mean for what you eat? Well, it means that what you eat is going to impact your body's ability to create that nice, healthy fiber structure that's needed within your gut for the bacteria to build the precursors that you need for your neurotransmitters in your brain. And it sounds kind of crazy to say that, but that's what's happening. And that's what's underlying that gut-brain connection. The other thing that's really fascinating in the literature is more and more things are coming to light that the precursors to your neurotransmitters that cannot cross the blood-brain barrier. So essentially, there's a blood-brain barrier and only certain things can get there. The stuff that we need to cross the blood-brain barrier comes from plants. Starches, to be exact. So nice, healthy, complex carbs underlie what we need to make serotonin. So, I could nerd out on this and like take you into the weeds, but the reality is it's really important to know that fiber is key in giving your body the ability to make what it needs to have a healthy emotional response system, in addition to those nice, complex carbs. So those are two things that I try to teach all of my patients. And then the other piece is hydration. So staying hydrated, that's so very important for our brain's ability to focus and concentrate, for our entire body to function. But there's a lot of literature on the impairments that happen in the brain's ability to focus and concentrate if it's dehydrated. So I think that's an area that we focus on heavily in mental health is making sure that you're setting your body and brain up for success to do what it needs to do.
So being the nerdy dietitian, I want to talk about food a little bit more in detail, because I know you just mentioned that plant foods have a particular superpower, and that when we consume them, their components, if you will, are capable of crossing over that blood-brain barrier. And in doing so, did I hear you right that this is where it's going to be, I guess you could call it the components or the building blocks to building the neurotransmitters that we need to have a particular mood or, to be happy or whatever. Is that
for
right?
Serotonin? Yes. So specifically for serotonin, so there's emerging data on norepinephrine and dopamine, but we have really good reproducible data on serotonin, that tryptophan, the precursor to what our body needs to make serotonin. And then we also need the B vitamins. Mm-hmm. All of those things have to get across that blood-brain barrier. And so it's really exciting to know that we get them from those nice starchy vegetables and complex carbs.
Love it. I love it.
And so just
Churches
an
over here.
interesting thought to like food for thought. So I don't know if anyone's ever experienced this intense sense of just wanting carbohydrates when you're sad, or this sense of, I don't know why I eat when I'm stressed and I am drawn to carbs. That's why.
It's almost like your brain is out of fuel, and that's the fuel that it needs. So, and then you mentioned fiber is also key. And, you always hear about brain, like foods that help brain health. So like, what are your favorite go-tos? And I'll back this up saying, any food that has fiber and nutrients is good for overall health. It's really difficult, if not impossible, to just isolate. You don't just eat one thing, you eat like all these components, all these wonderful nutrients that come in a package. But what are the foods that help the brain that you recommend to your clients, especially the kiddos? Like what is really well received?
Yeah. So I really try to hone in on complex carbohydrates. So those whole grains and potatoes. So not French fries, but baked potatoes, sweet potatoes. And then looking at things that contain magnesium. So walnuts, or amplifying mushrooms if kids will eat them, but that's more from a vitamin D perspective. So when I think through the different categories of the nutrients that we're targeting in a mental health aspect, we're thinking about those precursors to our neurotransmitters. So tryptophan, which we've discussed. Vitamin D is really important, which we get from sunshine. But then most Americans are actually deficient. So spending time outside, but then also making sure that you're eating things like mushrooms, walnuts, other sources of vitamin D. And then building that fibrous network. I really think that's so person specific, and I want to validate and empower my patients. So if someone's telling me, guess what, I tried blueberries this week, then we're celebrating that, and it's okay, keep eating blueberries. And one of the things I learned from a really good friend, Adam Sudd, is just supporting people doing a 7-day experiment. So what that means is, for a lot of my patients, eating fresh, real food every single day, every single meal feels too overwhelming. So just that buy-in to start increasing real food that's not out of a package or a can is something that I think is going to improve their mental health.
Yeah.
So anyways, the last thing I would say is helping individuals understand, if we can decrease the inflammation within their body, that also will improve their mental health.
I assume they'd be in less pain. That always is nice.
Pain. Yeah. And there's just more and more research on like cytokines and inflammation response, and what is that really doing to our brain's ability to regulate our mood.
Excellent. So we have a question over here in the chat. Okay. We have a question that says, are there functional MRI changes seen in the brain of persons eating a high fiber complex carb diet versus one that does not?
So it's a really wonderful, specific question. And I would have to dive into the research to find a specific answer for you. What I can say is what the functional MRIs show is positive changes in the brain areas for focus and concentration. And then it's the different areas of the brain that are lighting up based on an individual's experience. So it's improved function is what is being seen, or less dysregulation. So I would be happy to dive into literature and see if I can get you a specific question, your specific question answered, but I don't have that off the top of my head. I can say anecdotally, yes, but I can't speak to a specific study.
Yeah. And then what about omega-3s? Because I've heard Rhonda Patrick talking about omega-3s and mood and mental stuff. And she's sort of, I believe she's a PhD researcher and has an interesting podcast, but she's constantly talking about omega-3s and brain health?
Yes. So this is such an important topic because the answer is not just omega-3s. So our brain needs both omega-3s and omega-6. They're polyunsaturated fatty acids. So the challenge is most Americans are eating processed foods that are stabilized and or contain unhealthy amounts of omega-6. So then what happens is there's an imbalance of the ratio in our brains of omega-3 to omega-6. So we have this huge push for people increasing omega-3s, but really the conversation is what is in your diet that's causing this imbalance between the omega-6 and the omega-3s. So I think if you come at it from both angles, doing that dietary inventory, do we need to decrease that omega-6 component and increase the omega-3? So I just want to clarify, it's not just amplifying omega-3s, it's being mindful, is there actually too much of that omega-6? And that's what's giving us the imbalance. So you actually want a 3-to-1 ratio. You want 3 omega-3s for every 1 omega-6. So I don't know if that answers your question.
Yes. And do you recommend, especially for kids, that they're supplementing with an algae-based omega-3?
No, I do not. I actually, in children, don't recommend any food supplements unless there is a special need, and that's on a case-by-case basis. I work with families on getting what they need through whole foods. Smoothies are a really great way to do that, or even baking things. So trying to get creative, popsicles. Again, on case-by-case basis, supplements play a role and they can be really supportive, but I also want to empower people to trust food, real food, and their bodies to do what they're supposed to do. Our bodies want to be well. And so if we set ourselves up for that, typically we see that's what happens.
Okay. So like you would do something like flax or like chia seeds.
Yes. Yeah.
Something like
these.
And then just to confirm with the omega-6s, I know that to be a lot of the different kinds of oils. So cottonseed, soybean oil, safflower oil, corn oil, vegetable oil, etc. So, and then you're gonna see it in some like your animal protein as well. And so, like you said, always trying to start wherever you're at. And if that means adding in. If you get to a place where you're either plateauing or you feel like you're ready to graduate to, sharpening the pencil a little more, this is an area where if you are looking to try and decrease anything, these refined fats in the form of oils are a good place to start.
That's such a good point, Heather, because I just briefly mentioned processed foods, but the reality is it could be oil that you're putting in a pan to saute veggies. And that simple shift to doing water saute or broth could drastically improve the ratio of omega-6 to omega-3.
Yeah, for sure. Awesome. I've really gotten into walnuts lately. Yeah, that's, I'm honestly I don't want to say I'm not a big fan of nuts, but I'm not a really big, it's not something that was in my diet on a regular basis. And I've really started to try and add the walnuts. For some reason, they seem to be a little bit easier than chia seeds. So. Yeah.
Just a fun fact, when I first started practicing as a nurse practitioner was when I had transitioned to being plant-based. So I went plant-based in 2012 and I graduated as a nurse practitioner in 2013. And I had a drug rep come to my office and say there were no nutritional sources of omega-3. That's why we needed to use this medical food prescription. And it was just a really enlightening moment for me to learn how to have a kind conversation and to understand, okay, so where are people coming from in an effort to improve health outcomes with these supplements? They have a place and they can be really helpful, but also to be mindful that we're having that full conversation and we're not just skipping over the fact that we actually have food sources that could meet our body's nutritional needs. And so it's exciting to me to have conversations like this, because that just empowers people to keep being curious. Like, what are the ways that I can benefit my health and my family's health, and for healthcare providers to continue to have depth of knowledge and confidence when we're having these conversations, to not feel like this is pseudoscience, because it's not. There's so much more data now than there was 10 years ago.
Yeah. Yep. I love it.
So, would we like to move on to lifestyle hacks, Heather?
Yeah.
Okay. So Liz, what we're going to do next is ask you some questions, and Heather and I will alternate back and forth, but we're going to talk a little bit more just about you and what your likes are and things like that. And then maybe some tips that you've got on some different hacks. So the first question is, what is your favorite local restaurant in the Jacksonville area or the surrounding area? And what are the dishes that you eat when you go to that restaurant or those restaurants?
This is such a good question. So Jacksonville has room to improve, but you can be creative. And there are some really awesome vegan and vegetarian friendly places. I actually really love Flying Iguana. It's out in Atlantic Beach, and they have a vegan and vegetarian taco that rotates, and I love their salsa. And then they're pretty creative. One of my hacks, any restaurant I go to, I order sides and I just create my own bowl wherever I go. And my husband calls it the side hustle, because it's like, I will find a way to make something fun no matter where I go. And even friends have picked up on that, and they'll say, I'm going to wait until she orders, and then I'll just have that. But I do enjoy Flying Iguana if I'm doing something out.
Oh, I don't think we've heard Flying Iguana yet.
Oh,
so
then we need to go there. That's our next dinner date.
I know. Good idea.
And just so you guys know, there's another Flying Iguana. It's on Park and Avenue.
Fun. Let's go there. I haven't been to that location.
Yeah. So awesome. Okay. So, what is your favorite plant-based money hack? Like, how do you keep money? How do you keep those costs down?
How do I save the dollars?
Yeah.
So buying in bulk and buying on sale. So when whole wheat pasta is on sale, stocking up then, planning ahead, cooking in bulk. So just freezing things. I find that saves costs. Making random soups from what's left in my fridge, getting creative in that way. But I would say adding intentional thought and planning to shopping saves costs. So just by not wandering the grocery store and buying a bunch of random stuff. So buying what's in season and on sale, I find is really helpful. And then cleaning out my pantry. Honestly, I do that probably 3 or 4 times a year. And that is a really helpful way to remind myself what I've stocked up on and to cook it before it goes bad.
Yeah. Yeah. I love that. I did a pantry reboot, like in terms of organization, about 1.5 years ago. And it made all the difference, because now it's like everything really has its spot. I've never been that person on any level in any area of my life. But when I did it for my pantry, it's like, I always know what I have and don't have. There's no guessing.
Right.
It's
really
good.
good.
Yeah.
Okay. So the next one would be your best time-saving hack. So a lot of people say eating healthy, it's so expensive and it takes so much time. So we went over the saving money, but what are some ways that you save time? Because I'm assuming you cook a lot at home.
Yeah. Yes. So how do I save time? I cook in bulk or batch cook, whatever language you want to use. How do I save time? I cook 2 or 3 meals at the same time. So I'm someone who on Sunday or Monday, I'm going to cook a bunch of meals, and then I'm going to freeze and put some in the refrigerator. And I find that that saves me time throughout the week. And I've gotten really kind of good at a system. I know which meals are kind of complementary. And so it's easy for me to do that at the same time. And then when I'm really hungry on a Wednesday, instead of feeling like we don't have anything and I need to get something on my way home, I remember I already cooked earlier this week. So
Oh, that is, do you have a rolling list of recipes that you kind of rotate through every 2 weeks or something?
Yes and no. It's loosely structured. It's not as structured as every 2 weeks, but yes, I definitely do. I have probably 5 to 7 go-tos, and then my husband has 2 or 3. And so we'll kind of trade off, but yes, definitely. To the point where stuff has had to be rotated off the menu because I made black bean soup so many times. Like I could literally eat black bean soup and baked potatoes for the rest of my life. And my husband cannot. And so we haven't had that in like 6 months. So we'll bring it back.
That's me and chickpea salad.
Yeah.
If someone wanted to feed me that every day, I would not complain.
Right. That sounds good.
Yeah. All right. So I know one of the first things you mentioned today was talking about adding in. Mm-hmm. So besides this concept of adding in, we know from every aspect of life that knowing what to do is not good enough. And especially when it comes to dietary changes, one of the number one things I hear is I know what to do. I just need to do it. Mm-hmm. And so what would you say is your best advice for someone who wants to move towards eating more plant-based foods in their diet, but they just seem to be in this like little circular, where they just kind of either start and stop or can't even get started. So, mm-hmm. So what is your advice for that person that's really struggling to gain some traction?
Well, my first statement would be curiosity is progress. So the more curious you are, that means you're engaging in the stages of change and validating that sense of frustration. I think a lot of times there's this sense of being misunderstood, and that's what keeps us stuck. And so I like to validate people where they're at. How can I meet you where you are? And then finding out, is there a specific hurdle? What do you feel like is the biggest barrier? Because if it is a perceived barrier versus a real barrier, then that might help us exit the loop. If that makes sense. Like if it's a perceived barrier, just a fear or an unknown or something we need to clarify versus a real barrier, like, no, I don't know how to cook, or I don't like vegetables. So how do I eat plant-based? So, in entering into a practical solution is something that I really enjoy doing with people, and also clarifying the why. Why do you even want to do it?
If they say they don't like vegetables,
what
do you say if they don't like vegetables?
Well, I ask if they like potatoes or beans or rice. I mean, let's start somewhere.
Yeah. There's a lot of low-hanging fruit, and it may not be fruit.
If you like fruit, you may not like vegetables. Honestly, I work with children, so they don't like a lot of things. And it's super rare that it happens, but it's super rare that kids will say no to bananas. Like that's an entry point. Mm-hmm. Banana smoothie, throw in a ton of spinach. We'll be patient. Their taste buds will change.
And I don't want to be dismissive of the comment you last made about the why. I think that I've seen with my patients that the clients that kind of kick the can down the road and defining what their why is are the ones that really struggle. And I even have a conversation with people talking about picking a visual representation of their why. And that it may be a picture, but it also may be an object that reminds them of something, whatever it may be. I had a man who had his mom's medicine bag that was full of medications right before she passed. And it was very powerful. Like, how could you ever come up with that yourself, right? Like, that's a very personal thing. So it has to be personal. It has to bring you almost to tears. I call it the why that makes you cry. So yeah.
That's really powerful. And I think a lot of individuals, I love that you said kick the can down the road. I think a lot of individuals have a sense of what they need to do and a very strong desire, but that gap is the why.
Yeah.
And our brain, that emotional center, is not our verbal center. So if the emotional center is what's driving and it's still too hard to articulate, that's our opportunity as healthcare providers to hold space and validate. It's okay if you don't know yet. Let's keep seeing where you are. And the more that we meet people where they are, the more brave they can become to say, well, this is actually my why. I mean, I'm just thinking of somebody saying their mother passing and then the medication bag, like that is intensely emotional. I can imagine that would be a really hard thing to articulate.
Yeah, absolutely. Especially if you haven't lived through that, right?
Right. Yeah.
Like, yeah.
I actually have a question that I would like to kind of insert here. And it's what do you eat in a day? What's a normal day of meals for you?
What do I eat in a day?
Black bean soup.
If I can make my black bean soup, I do eat beans a lot. Okay. So what do I eat in a day? I either have fruit for breakfast. So whatever fruit is in my house or in season, and or oatmeal for breakfast. And I do drink coffee. So I drink coffee. I do drink it black most of the time, or I'll put a little soy milk. And then for lunch, I have right now, some days I'm working at JU and we have a lovely campus with a salad bar. So I eat, it's whatever's on the salad bar, greens, veggies, all the things, and then whole grain rice. And sometimes they'll have like a hot bar station, and then I'll just have them put whatever on top. Like today it was veggies and they had squash and broccoli and beans. So I just do a buildable. That's a really common term we use with Plant Strong. So I just build a bowl. I do that at home as well. So if I have greens in the fridge, I always put that as my base. And then I might do a whole grain, whether that's quinoa or rice, and then beans and veggies. And then I snack on random things like celery. Sometimes I will do like popcorn, like an air popped popcorn. I really love popcorn. So that's like a big snack. And then for dinner, recently I've been doing things that are really easy. I have an 8-month-old baby. So my time has been divided in a new way. But last week, something I really enjoyed was doing a baked spaghetti. So like a whole grain noodle and some squash and zucchini and then a pasta sauce, and then just like set it and forget it. So that, but I am really into my new soup that you guys are sharing the recipe. So I've made that twice since I made it the first time. So I know that was kind of all over the place, but I'm eating whatever is fresh and in front of me.
Yeah.
Not a picky eater. And I think that's hard when individuals are, and then they hear something like this. It sounds kind of rambling. And I'm like, just the fruits and veggies. But really, when you start eating plant-based, things taste delicious, and it's fun to just make random assortments of food and add hummus or a balsamic vinegar or lemon juice, avocado, those types of things can really take a dish that sounds kind of boring to a new level.
Those are really good tips. I wrote that down.
Yeah. So what's your son's favorite food at this point?
Oh, this week we tried mangoes. So those are new and he's loving it. He's into fruit. He's into the fruit right now. Bananas, mangoes.
Love it.
Yeah. He loves squash, which was surprising, but I guess it is kind of a fun little starchy.
Nice.
Yeah. Oh gosh, I had something else I was the popcorn. I find I brought, when we were doing a lot of the kids cooking classes in the St. Johns County School District, you would find those popcorn makers at thrift stores where you can just throw in the popcorn and the kids went crazy over the
Such a fun activity. I bet they did.
And then we would do like garlic powder and nutritional yeast, and they would get to dress it up. And I had to really be careful because sometimes I'd have a teacher there trying to teach whatever the recipe of the day was. And I, with my popcorn maker, and then nobody would want to make the recipe.
Yeah, that's too much fun.
Yeah, that's a good. Okay, Heather, I think you're next.
Okay, so let's talk about, it's not just about the layperson and, the patients and all of that. I like to get to, if there's someone out there listening who is a nurse practitioner or an up and coming nurse practitioner, what advice do you have to them? And, or, your colleagues who may not be bringing up nutrition in their conversations with their clients, where is the benefit in doing so? What have you found, or what advice to them do you have? So kind of take all that.
Yeah, I think that's a really timely question because I am teaching in the graduate nursing program here at Jacksonville University. And I had the privilege of teaching in the FNP family nurse practitioner track this past spring. And I think I would be doing an injustice to these students by not discussing nutrition. It's, I think, the most compelling evidence we have for our body's ability to be healthy. And so I want to be empowering my students to go out and be nurse practitioners that are fully informed of all of the evidence. So I think my conversation with other nurse practitioners and other healthcare professionals is not that this is a panacea and we don't need modern medicine, but that we shouldn't be walking through, our clinical practice and holding our hands over our eyes when we have this wealth of knowledge. And so I love to pique my colleagues' curiosity. So I just like to ask questions or to encourage them to watch documentaries. There are so many, and I'm sure some of the individuals watching this have seen them: Forks Over Knives, Game Changers, Food Inc. There's lots of them. So I think by engaging individuals' curiosity, it's an entry point for them to either do more research on their own, and then they come back with questions. I have not found a single healthcare provider that I have started having this conversation with that doesn't engage in a way that's positive. So there might be a little bristling at first, like, okay, but the reality is they're intrigued for the most part. Yeah. And a lot of times cholesterol is a big buy-in. So when saying, our bodies can make all the cholesterol we need, we do not need to be eating meat and animal products. That's a fun entry point in healthcare, I think, for individuals who are prescribing, statins and medication to reduce cholesterol.
Yeah, we have a comment. One of our participants online here said that she taught nutrition at a BSN program using the case study approach, and also saw them in clinical.
That's awesome.
Yeah.
Yeah. I think nurses are the secret weapon in America for improving healthcare, but we just have to keep spreading the news about plant-based nutrition, because the reality is nurses are educators. They are the people at the bedside when everyone else walks outside the room. That was my entry point as a nurse. I had my diabetic educator come in and give my patient who had just been given morphine their education on diabetes. And so they're in a high level of pain. They've just been given a medication where now they're sleepy. They were not in a place to be learning about how to take on a whole new lifestyle. So I think the more our nurses are the people who can walk alongside in all the different healthcare settings that nurses are in community settings, we would have a really awesome opportunity to change outcomes and health disparities in our country.
Yeah.
I agree.
Yeah, it's huge.
I know.
All right, last question, Dawn, take it away.
Okay. So we have one last question, but I want to backtrack just a second before we get to that. And I know we've got only like 15 minutes left, but what do parents ever ask, what are some things we should really avoid for mental health? And I think we kind of skimmed over it, but what would you say are the top 3 things if a parent comes in, they're eating sort of the standard American diet and nutrition is completely new to them?
Yeah.
What would be some things? I know we talk about adding in, which I think is awesome, but
Yeah.
I know I'd be curious about what are some things I should avoid?
Absolutely. So I like to use the language trade. So because I'm trained in mental health, I'm always cognizant of someone's relationship with food and risk factors for eating disorders. And so as opposed to creating these categories in someone's mind, like good food, bad food, I like to encourage people to think about, could we just make a trade? Could we make a switch and do that 7-day experiment? And let's see if you're noticing a difference in how you feel. So for children, I encourage parents to make a trade for dairy. So let's see if you could try a nut milk for 7 days. So that's a big one. Another thing is a trade so it is not unreasonable for families to be eating things that are in a box or a bag, right? Life is busy. And so is there a way that we can make a trade from maybe a granola bar that's full of sugar and highly processed and maybe has corn syrup or other oils for something like a Lara bar or something with less ingredients? So that's another trade that I really encourage parents to make or avoid, but I like to use a different word. And then let's see, you asked for 3. So dairy, processed bars, and then caffeine. So I do work with a handful of high school and college age students. So there's still parental involvement, but I really work on educating individuals on the risks of high amounts of caffeine and what that can do to delaying your sleep. So that's stepping a little bit outside of nutrition and into lifestyle, but that's a big teaching point that I push.
That makes a lot of sense for sure. So like with all of those energy drinks out there, I think parents may not realize what it could be potentially doing to their brain and their sleep, and then all the additives in there.
And their blood sugar.
I mean, I remember I did a lot of work with elementary age kids, and just sometimes they would be drinking them, and I would just see their behavior before and after. And it's really sad how much it affected them. But I think people just don't know. Like they just.
No, people are doing the best that they can. And so if you're hearing this is a health drink and it's really good, and you're like, I want to give that to my 10-year-old, they're old enough, not understanding that it actually could be creating this intense like spike and change in their internal experience.
Mm-hmm. Mm-hmm. Okay. Heather, I think you're up.
All right. So basically, what is your current passion project? What are you doing? Where can people find you? What fun things are you doing?
Fun things that I am doing. Well, being a mom is a really fun thing that I'm doing, and I love it. But work-wise, I am loving teaching at Jacksonville University. So you can apply to go to nursing school. And I'm also, I own a private practice, Winings Wellness, and I love doing things like this, community education. I'm speaking on Thursday at the Jax Human Rights Council on anxiety in adolescents. So public health promotion and prevention is a huge passion project of mine for nutrition, lifestyle, and mental health. And then my favorite job is working with Plant Strong team. I get to be a part of their medical immersions, and we do those currently twice a year, and it's really fun. And so you can find me on social media, Winings Wellness. You can also join us for any of our Plant Strong events. They're really awesome, and they're in beautiful parts of the country. So
they are amazing locations.
I don't know that it's out yet. Oh, it is out. Hold on. I'm going to put this in the chat. You are doing a little webinar about specific to kids, pediatric health. So You Are What You Eat, kids mental health. It's June 8th from 6 to 7:30 p.m. Central Time. So 7 to 8:30 Eastern Time. So I put that in the chat. I put your website in the chat as well.
Yeah. I'm excited about that.
Yeah. Super stoked. I think that's it. I think that we've picked your brain enough,
Well,
maybe.
thank you for having me. This was fun.
Yeah.
Thank you so
Awesome.
much. Before we sign off, do we have any final questions? You can feel free to just put them in the chat or anything like that. But, and also if you think of something afterwards, you can always send either Heather or I an email or just contact Liz directly. But yeah, thank you so much for you guys for all coming and participating. This was so much fun.
Yeah, the replay will be on both Dawn Hutchins' YouTube as well as my YouTube. So Dawn's is Veggie Cooking and mine is Kylo Nutrition. So make sure you go to one of our YouTubes and just check out the replay. It'll be up by the end of the week. So
yeah. And we hope that you will also join us for our next event with Dr. Nields. And we're going to be talking about Alzheimer's and dementia awareness.
Super important.
Yes.
Yes. So Lisa says we should do lunch meetups. I think that's fantastic idea.
That would be cool. And I also said it would be really cool to be able to have some kind of a recipe. That would be awesome.
Yeah. So we're going to do a cookbook based on all 12 recipes that we have from our folks that came that are talking each month. So that'll come at the end of the year.
Awesome. We should put really cool stuff out there.
Yeah. I'm super stoked. So, all right. Well, thank you so much for your time, Dr. Winings.
You're welcome. Have a great night, you guys.
Thank you. Hope to see you